we talk a lot during treatment week about stigma, and the importance of kind of ending that stigma. It's a barrier to treatment for a lot of people. How do you perceive the current state of stigma, surrounding addiction? What are some of the misconceptions that you've seen in your work around addiction that you think need to be addressed? What are some of those issues that you think still need to be kind of looked at and resolved?
It feels like we've come a good way since I started my medical career in around 2017, but there's just still so much work to be done. And in a lot of ways, it looks like I was just admitting patients to the hospital over the weekend, and I was very grateful to have a patient who had opioid use disorder, was able to start them on buprenorphine. They were also withdrawing from other substances, and I detailed very clearly in my note what needed to be done. Used person first language as a person with opioid use disorder. The next day, I went to look in the chart to see what happened to the patient. Thankfully, they were still there. They were still getting treatment. But the note the next day from the outgoing provider was throwing abuse, a lot of other really words that I think really do reshape how we think about our patients. And it just went to show that, like, even though I am one provider out in the world using this sort of language, it takes way more than that to shape everyone's perspective on this. And it would have been way easier. This is what made me laugh. It would have been way easier for this doc to just copy and paste my note from the day before, but they went out of the way to change the language into how they view this disease. And I share that example just to highlight that there's still so much work to be done. And I think a lot of it stems from people not really understanding what addiction is. And I think it's tough because we've seen that education alone does not really change people's perceptions on patients or perceptions of people. So I think a lot of the work that the next phase, I think, of reducing stigma is figuring out how can we help people one on one, like develop relationships with people with lived experience, or develop relationships with people who are in the field. Because to me, that's what's really, I think, transformed my heart. Like our hearts aren't changed by knowledge, our hearts are changed by relationships, and figuring out how we can help general providers like have their hearts touched by our patients who come with so much incredible expertise. That's, I think, the next phase of the challenges that we face.